So I'm one of those poor souls that Sid mentioned is doing their first ever presentation, so bear with me. I hope I'm clear enough. My name is Aoife. I'm a postgrad research student here at the University of Manchester, and I'm going to talk a little bit about the neuropsychology of Kabuki syndrome. So we have had lots of other talks this morning about, so I'm not going to go into detail about genetic mechanisms or clinical features of the syndrome, also because that is absolutely not my area of expertise. But I'm aware that there's varying levels of knowledge about and experience with the syndrome in the room. So as a brief recap, the 5 cardinal manifestations, as they call it, so basically the key features of Kabuki syndrome, are limited growth, distinctive facial features, skeletal anomalies, dermatoglyphic abnormalities, and altered development. And I'm specifically interested in this last feature. So there's lots of different elements to development, including thinking skills, behaviour, and ability to complete activities of daily living. So I'm going to talk about all 3 of those. Starting with thinking skills, there is a broad range of cognitive abilities seen across individuals with a diagnosis of Kabuki syndrome. Some people function at a similar level to others their age, although up to 90% of people with Kabuki syndrome struggle with thinking skills such as intelligence. Now, intelligence is comprised of lots of different cognitive abilities, and it's really common across the population for people to maybe be strong in one area and weaker in another. So numerous investigations into the pattern of cognitive strengths and weaknesses associated with Kabuki syndrome have shown that people with a diagnosis tend to have stronger verbal abilities than visual abilities. So what this means is that in general, people with Kabuki syndrome find it easier to think about and to remember information that has been delivered verbally. They find it easier to express themselves using words than they might do to process visual details or analyse spatial relationships. So as well as the abilities that affect a person's performance at work or at school, it's also important to think about how a diagnosis of Kabuki syndrome influences a person's adaptive functioning. And this is just a fancy way of saying their ability to complete basic activities of daily living. Again, most of the studies have shown that people with Kabuki syndrome struggle with these activities a little bit more than their typically developing peers. So the results indicate that people with Kabuki syndrome might need a little bit more help with things such as eating, dressing, washing, and general healthcare than other people the same age. Interestingly, a lot of activities of daily living do rely on intact visual ability for completion. So if you think about it, you have to be able to visualise where your body is relative to a stream of water coming out of a shower in order to wash properly. And I just give this little example because it's a nice kind of demonstration of potential mechanisms through which cognitive ability can impact on our daily functioning. Now, most positively, these studies have all found that people with a diagnosis of Kabuki syndrome show age-appropriate levels of desire to interact with other people socially. And indeed, any geneticist or clinician that I've spoken to so far has assured me that they're a very friendly population. I'm going to really enjoy getting to know them. So I am looking forward to doing a bit of work in this area. Though, as it kind of became clear from Melody's presentation this morning, some people with Kabuki syndrome struggle to pronounce words clearly, and that can have an impact on communication skills. So when we talk about the neuropsychology of any kind of syndrome, we're talking about more than just cognition. With this in mind, there has been an increase recently in research that is looking at the behavioural features associated with a diagnosis of Kabuki syndrome. And there is one research team in America who seem to be particularly driving this. They've done lots of little projects into it. Just earlier this year, they published a paper that demonstrated that people with Kabuki syndrome tend to have a more limited attention span than other people their age. They've also done a study that showed that children with a diagnosis of Kabuki syndrome tend to have higher levels of anxiety than their unaffected siblings, and that sleep disturbances are a common feature of the syndrome. And this feature is important to know about because disrupted sleep hygiene can have further repercussions on things like cognitive functioning and mood day to day. And then there are mentions of autistic-like behaviours throughout the literature on Kabuki syndrome, and these tend to manifest as maybe a preference to be alone, or maybe having reduced eye contact, or maybe a selective interest in kind of specific topics or objects in the Kabuki population. Of course, every individual is unique, so not everyone who has a diagnosis of Kabuki syndrome will present with any of these issues, or all of them necessarily. So now, I've been talking for 5-6 minutes about everything that we already know about Kabuki syndrome. And as I hope is clear to you all, we have learned quite a bit about the cognitive, behavioural, emotional and social functioning that's typical of the disorder. However, most of this learning has come from cross-sectional studies, wherein they did a one-off assessment, or from case studies of single patients. So that means that as of yet, there is no comprehensive longitudinal research into a group of individuals with Kabuki syndrome across multiple time points. And I am hoping to fill this gap in the literature. To achieve this, I'm going to review the literature and what's already been done and examine the data that I already have available to me here in Manchester to try and minimise overlap. And I will liaise with a group of experts by experience, which will be comprised of healthcare professionals, family members and caregivers who see the impact of Kabuki syndrome on daily functioning. And I'll consult with these people to learn more about their primary concerns and to identify some of the issues that they encounter most frequently, so that I can learn which are the most important aspects of development to measure in the syndrome and the most appropriate means through which to do this. So then once I've drafted my research protocol, I'll invite individuals with a diagnosis of Kabuki syndrome to come and complete a neuropsychological assessment with me. My background is in paediatrics, so the line we usually give is this means doing puzzles and games on an iPad. But to be honest, it's not that different in adults, it's obviously just increased difficulty. And then I will ask anyone who has previously undergone neuropsych assessment as part of their routine NHS care for their permission to access these records, which will give me neuropsychological data across 2 separate time points. So what will this project mean for individuals with Kabuki syndrome? Well, by looking at their functioning at 2 different time points, we hope to learn more about how development occurs in this syndrome and to determine whether all skills develop equally or whether we can expect specific strengths or weaknesses at different life stages. And this information can be used to better anticipate the type and level of support that individuals with Kabuki syndrome might benefit from having access to at different points in their lives. And it can inform the clinical services and educational support that is offered to individuals with Kabuki syndrome in the future. So the study that I have described here will feed into a larger project, which is looking at how best to measure neuropsychological and behavioural functioning in rare conditions in general. And my plan is to integrate the kind of lessons learned from each sub-study to establish a framework for the efficient neuropsych assessment of, in a way that's achievable and accessible for individuals across disorders. Yep.